I'm Tatiana.
And I'm Georgia.
And today we're going to be talking about the dengue virus. So first we're going to begin with a small introduction. What causes dengue fever? How does this happen? And what is dengue?
So dengue fever is a disease caused by the dengue virus, which is primarily spread by the Aedes aegypti mosquito. So the virus is a Baltimore group 4 virus, which means that it's positive sense, single-stranded RNA, and it belongs to the family Flaviviridae and genus Flavivirus. So other members of the Flavivirus genus include West Nile virus, tick-borne encephalitis virus, yellow fever virus, and Zika virus. All of these are also Baltimore group 4 viruses. Zika and yellow fever are also spread through the Aedes aegypti mosquito. So dengue is spherical in shape and around 40 to 60 nanometers in size. But what are some more specific elements of its structure?
So when we look at the dengue virus, we notice that inside of the virus is a nucleocapsid, which is made of the viral genome and the C proteins, or capsid proteins, which can be seen in the diagram right there. Deep to the capsid proteins, the positive sense single-stranded RNA can be found. This contains all information giving the virion its identity and determining its serotype or genotype, which we'll talk about a little bit more later. The nucleocapsid is then surrounded by viral envelope, a phospholipid bilayer that is taken from the host upon cell entry. Embedded in the viral envelope are the E and M proteins that are located throughout the envelope. E proteins are then divided further into 3 domains. Domain 1 is responsible for providing the virion its central structure. Domain 2 is responsible for dimerization, and domain 3 is responsible for the receptor binding and the viral attachment to host cells. Embedded within these is the fusion peptide, which is needed for membrane fusion between the host's phospholipid bilayer and the virion's E proteins, a process that leads to envelope creation. The M protein is then responsible for inciting host cell apoptosis, although the exact mechanisms for this are still being studied. However, we do know that it is probably going to be triggering some sort of pathway on host cells that leads to apoptosis. Research even suggests that cells with higher levels of BCL2, remember that tumor suppressor gene, is actually going to combat apoptosis in these cells. Alright, so now let's take a look at the serotypes and genotypes that we can see inside the dengue virus. So until 2013, it was only believed that 4 serotypes existed, DENV1 through DENV4. However, in 2013, we saw the discovery of the DENV5 virus, which added a new serotype. Most of these serotypes are antigenically unique, but are actually genetically fairly similar. Most serotypes follow the human cycle, meaning it is transmitted among humans, but carried through a vector, in this case the Aedes aegypti mosquito. Only some genotypes of the DENV2 and the DENV5 actually follow a sylvatic cycle, meaning that it only spreads between animals. Within these serotypes, we also see different genotypes, which causes further variation in the virus. It is common that these genotypes actually are going to cause new traits within the virus, but only slightly different ones, so that it's not a new serotype, but simply kind of a new form of the serotype. These genotypes typically vary the speed in reproduction and plaque formation. So plaque is basically a visible structure that's typically measured in cell cultures as a virus spreads and replicates. It creates regions of cellular death known as plaque, and that's kind of how we are able to track the damage that these cells are doing as they spread throughout the human body. So now let's look at some dengue statistics. So first, we see that there are around 50 million to 100 million cases of dengue each year, and this is a really high number. And of those, we see that we have around 22,000 deaths each year, which might seem shocking, but actually if you compare it to the number of cases, it's not terrible, and we're still trying to work on some treatment options that we'll talk about later. So it's most common arborovirus, which means it's the most common mosquito-borne illness. So we see that, 50 million to 100 million cases of dengue virus per year. That's quite a few. So now we're going to move on to talking a little bit about the spread.
So how exactly does the dengue virus spread? Well, as we talked about before, it spreads via the infected female Aedes aegypti mosquito. So what happens is the mosquito bites a person, and it takes the infected person's blood about a week, and then it spreads it to other people, and when the healthy people are bitten by the mosquito, they contract the disease. And it's zoonotic, which means that it spreads from infected mosquitoes to humans, or from infected humans to mosquitoes.
All right, so now we're going to take a quick look at a map of dengue fever cases around the world. So here we see the world map, and we see that the red regions represent where the mosquito, the Aedes aegypti mosquito, and dengue fever are actually common. So this is really where we see dengue virus is kind of most prevalent. In the blue regions, we see really where just the Aedes aegypti mosquito is present, but what this means is that we could actually see the dengue virus and dengue fever spread into these regions. So we see a lot of areas in Central and Latin America, we see some regions in Asia and Africa, and it's kind of starting to creep into the US a tiny bit. So really, we also notice that between these two yellow bands is where it's most focused. Again, that's areas near the equator where it's really warm, kind of tropical or subtropical, and that's really where these mosquitoes thrive, meaning that you're going to see pretty high numbers of the dengue virus there. So now we're going to continue to kind of where it spread, kind of continue this discussion. So more than 96 million cases have been reported around each year of the dengue virus and dengue fever. So it's most common in these tropical areas or areas that are prone to mosquitoes, again, specifically the Aedes aegypti mosquito. Cases have also been reported in over 60 countries. So in all, over 2.8 billion people are at risk. That's about 40% of the world's population, which is really shocking if you think about it.
So now we're going to go into some details of the pathophysiology of the dengue virus, basically how it invades and how it works. So how does dengue exactly cause disease? Well, dengue causes disease in a few ways. So, as I mentioned earlier, the primary method is via a bite from an infected mosquito. Usually, dengue is transmitted by Aedes aegypti, but due to its tendency to lay its eggs and live near humans. This is similar to its fellow Baltimore group 4 virus, yellow fever's transmission, as it relies on the Aedes aegypti mosquito to spread. Zika also relies on the Aedes aegypti mosquito. Dengue can also be transmitted via infected blood products and through organ donation. So basically, if somebody has dengue and they either donate an organ or give blood, the person who's receiving the organ can receive dengue as well, along with the organ or blood transplant. And this is a big problem in countries where dengue is quite common, like countries in Southeast Asia. So transmission from other to child, or vertical transmission, has also been recorded. It's pretty rare, but apparently it still happens. As dengue, there's not a lot of research on dengue. People don't exactly know why at this point. However, it apparently still happens. So even another form of translation, needle stick transmission, has also been recorded. And basically, needle stick transmission is when you poke yourself with a dengue-contaminated needle or medical instrument, and it's typically regulated to medical personnel, as these are the people most handling needles and other devices, IVs, of people who've had dengue. But it's very, very rare. Like, I think there's been less than 10 cases currently reported, and as there's not a lot of research on dengue in general, there's also not a lot of research on needle stick transmission, so we don't know exactly how that works either. So how does DNV invade the cell? Well, let's start off with attachment. So the dengue virus can attach to the cell using many different proteins. It really depends on the serotype, but there are 2 main receptors that allow dengue to attach to the cell and enter the membrane. The first is the DC sign receptor, which is common in dengue as well as Zika and yellow fever. They all use this receptor to get into cells. So these are found on the membranes of dendritic cells, macrophages, and Langerhans cells, which are really the first cells that dengue infects once the mosquito bites you and it enters your skin. So dengue can also attach to the cell membrane using mannose receptors, which are only found on macrophages. Moving on to entry. So both of these receptors allow dengue to perform receptor-mediated endocytosis, which basically means that the dengue virus gets enveloped in an endosome, which is like a big bubble that is comprised of the cell's membrane. So that's how it gets into the cell. A big bubble forms around it and it goes in. So once inside the endosome and inside the cell, the pH drops below 7, and this acidic pH allows the E proteins to undergo a conformational change, which means they form little spikes. And these spikes have hydrophobic tips, which allows them to break through the endosome's membrane. This causes the membrane to bend until the endosome's membrane fuses with the virus's membrane, and the capsid is released. And then the capsid breaks apart, and the viral RNA is released into the cell. So the viral RNA travels to the rough ER, and because it is positive sense RNA, it's super, super easy to replicate and complement, and it's translated into a polyprotein that is processed by viral and cellular proteases, and the viral non-structural proteins are replicated in the genome RNA at this time as well. So now on to assembly. The virus assembly occurs in the endoplasmic reticulum's membrane, where the C proteins, the capsid proteins, and the viral RNA are enveloped by the ER membrane and glycoproteins to form the immature virus particles. So the virus particles are then transported through the secretory pathway, and in the acidic environment of the trans-Golgi network, which is basically between the Golgi, furin-mediated cleavage of the PRM, which is the pre-M protein, membrane protein, drives the maturation of the virus. So basically, let's explain that and break that down. So when the virus is formed, it has these little proteins protecting the outer little spikes, if you will, of the E protein, so that it doesn't fuse and bind to the cell. But basically what happens is the acidic environment causes, and the furin-mediated cleavage causes these PRM, so pre-membrane proteins, to become membrane proteins as these little parts break off, and then the virus is released through exocytosis, so kind of like endocytosis, but the opposite, through the Golgi in a little vessel. So now let's move on to some pathophysiology, some more pathophysiology.
So to recap what Georgia said, when a mosquito bites a human, the infected saliva enters the bloodstream and the skin's dermis or epidermis. So once in the skin, the virus enters a dendritic cell or a macrophage, which both contain those DC sign receptors that are recognized by the dengue virus, and it enters via endosome, making the environment more acidic and then causing the endosome to actually have a negative charge. So once this happens, the virus exits the endosome of the and the viral RNA is then released, and the virus kind of hijacks the host cell to make copies of itself. The virus then fuses its membrane within the cell and is ready to go out and infect other cells. So let's kind of talk about how that happens. So virions within dendritic cells or macrophages are able to travel through the lymph system to other parts of the body. Additionally, infected dendritic cells and macrophages actually trigger the release of interferons and cytokines, which trigger an inflammatory response and lead to high fevers, inflammation, rash, and all those things that are associated with the symptoms of dengue fever. So following this, the virus will be able to infect the bloodstream. Here, it might make the blood vessels more permeable, resulting in plasma leakage from the bloodstream into the other parts of the body. And this is really what's characteristic of dengue hemorrhagic fever, which we'll talk a little bit more about later. We'll also see that the dengue virus is able to spread to other parts of the body. And what's really interesting about the dengue virus is that it's actually not specific to one type of receptor, which means that the cell could actually affect any other cell. So, in other words, it could affect the liver, it could affect your bones, your muscles, really anything, and that's kind of what makes it so scary. We also see the replication and cellular damage, and we see these M proteins, remember those that cause apoptosis, really causing damage kind of anywhere and in any other cell, which is, again, kind of terrifying if you think about it. So this diagram is really, it's a little blurry, but it's kind of showing that whole process in a nutshell. Again, we see that it can harm really all kinds of cells. There's endothelial cells, liver cells, tissues, macrophages, bone marrow, and just cause all sorts of harm to your body. So now let's look at a case study of a patient who has dengue fever. So a slightly overweight 9-year-old female walks into the emergency room complaining of a high fever, around 40 degrees Celsius or 104 degrees Fahrenheit, strong headache behind her eyes, muscle and joint pains. You also notice that her skin seems kind of flushed. So you ask her when her first symptoms began, and she replies that her symptoms began around 2 days ago. So you follow up that question and ask if she's been out of the country recently, and she replies that she returned from a trip to Mexico around 6 days ago. You're unsure about the culprit, but you don't really see any immediate danger, so you tell her to take acetaminophen and to go home and hope that her fever goes down, and if it doesn't, or if her symptoms worsen, to return. So 3 days later, she returns with a maculopapular rash, petechiae, clamminess, no fever, and bleeding from the gums. So you get a little concerned and you run some blood tests, and you notice that she's experiencing leakage of plasma. So all of a sudden you recall her trip to Mexico and you suspect dengue fever. So you give her some fluids and she exits the critical phase and enters the recovery phase of this disease, which we'll talk about in the next few slides. So ultimately she's admitted to the ICU to recover. So let's break this down a little bit. First, we see that she's 9 years old, slightly overweight. So although research is limited, we do see some evidence that in the critical phase of dengue, it's actually more common to affect children, especially females, and those with high BMIs. Next, moving on to her symptoms, we see that these are the symptoms of the febrile phase: the high fever, strong headache, muscle pain, joint pain, those kind of rash, skin flush type things that you see around the skin. And then you also see that later on, that rash, the petechiae, clamminess, those are all really symptoms of critical phase. So now let's look at the time frame of all of this. So first you see that her symptoms began 2 days ago. So the febrile phase symptoms last 2 to 7 days. So it's within that range. Next, we see that her trip to Mexico was 6 days ago. So this means that she's probably had the disease in her for at least 8 days. And we see that the typical incubation period of the dengue virus is actually 3 to 14 days. So again, she's within that range. Finally, we see 3 days later she returns. So the critical phase begins around 4 to 7 days into the course of the disease. So again, she's right within that range to be entering the critical phase. So let's talk about the symptoms in a little bit more detail now. So beginning with the primary symptoms of the febrile phase of dengue fever. First, we see a high fever, 38 to 40 degrees Celsius, which is around 100 to 105 degrees Fahrenheit, and at least 2 of the following: a headache, severe eye pain, usually behind the eyes, joint pain, muscle pain, bone pain, a rash, signs of internal bleeding, easy internal bleeding, bruising, petechiae, and a low white blood cell count. We also see that these muscle pains, bone pains, those are all characteristic of the other name of dengue fever, which is breakbone fever, because you really have kind of aches and pains everywhere, and it's really awful. So now we're going to look a little bit more into the critical phase, or the more severe symptoms that we see after around 3 to 7 days after the original infection. So we see severe abdominal pain and vomiting, petechiae, bleeding from the nose or gums, vomiting blood, black tarry stools, drowsiness or irritability, pale, cold, clammy skin, and difficulty breathing. We also see this. We see that this is kind of really characteristic of that critical phase, that more severe dengue fever that many people get. And sometimes the critical phase is going to go straight to the recovery phase. You kind of heal back, heal up, you get better, your antibodies do their job, and sometimes it leads to kind of a more severe form of dengue, known as dengue shock syndrome or dengue hemorrhagic fever, which is incredibly dangerous and can lead to death or, in some cases, also just recovery. So here's a rash, and here are some of the symptoms, again, recapped of dengue fever. So now let's talk about the critical phase subclasses of dengue. So again, this is that dengue shock syndrome and dengue hemorrhagic fever. So once a person enters the critical phase of dengue, they're at risk of entering dengue shock syndrome or dengue hemorrhagic fever, especially if this is their secondary infection, meaning that they've already been infected before but with a different serotype of dengue. And the reason this happens is because once you have that initial infection with dengue fever, your body builds up antibodies and is able to fight the dengue fever. However, if you're infected again with a different serotype, your body thinks it's already seen the disease, so it begins to fight that serotype with the old antibodies. However, it's a different serotype, which means that the antibodies that your body produced actually aren't going to have any effect on these new serotypes. So those serotypes are allowed to build up and can actually cause a lot more damage to your body. So this is where we see kind of plasma leakage, more or less of blood, internal bleeding, vomiting, and it's just really more severe symptoms of dengue. So these often go in hand with some extent of organ failure and increased internal bleeding, and they actually can be deadly, so they're pretty dangerous.
So now let's talk about some of the virulence factors behind dengue fever. So not much is known about the virulence factors of dengue, especially critical phase dengue, because there are no animals that show really the same symptoms. Like, the symptoms that we see in humans aren't often mirrored in like the sylvatic strains of dengue 2 and dengue 5 in other animals, and we don't really know why this is, but this basically means that we don't know a lot about the virulence factors because we can't really test them in humans because that's not exactly ethical. But so we do still know a few virulence factors. So the E protein, or envelope protein, which is the amino acid 390 at the 5 and 3 untranslated regions, is a virulence factor, and it acts to reduce or amplify virus replication in human monocytes and dendritic cells. And the E protein varies by serotype, but it's critical to the replication, and it's critical to the severity of the disease. So another one of the primary known virulence factors is all of the serotypes of dengue virus. As Katiana talked about earlier, once you have a serotype in the body, the immune system produces antibodies, right? And those adhere to specific structural proteins present on the virus, inhibiting it from infecting macrophages and dendritic cells and all of that. And so that's when we see all the febrile stage symptoms that Katiana talked about. But upon exposure to a different serotype of dengue, antibodies for the first serotype are sometimes released, but the antibody adherence doesn't occur because either it has no effect, or it occurs and has no effect, or because the proteins are completely different structural proteins. So this means that the virus can then invade these macrophages and induce the release of cytokines, which compromise the tissue permeability and can lead to dengue hemorrhagic fever or dengue shock syndrome. And this whole phenomenon is known as antibody-dependent enhancement. So, in addition, dengue viruses also have the M proteins that we talked about earlier that aid in apoptosis of their target cell, but as I said just a slide ago, they haven't really been studied as it's hard to study dengue's virulence factors.
So now we're going to look into a few treatment options for dengue fever. So really, it's kind of sad because we don't actually have that many treatment options for dengue. Really, most of our treatment options are actually focused around symptom management and fluid resuscitation. So basically getting fluids back into the body to make sure that the human body is actually physically able to fight off dengue fever. Also, fever can be managed by taking acetaminophen or paracetamol. However, these aren't really going to do much except for just managing the fever, managing the symptom, and making sure that the body can fight off the disease. So again, we should also note that aspirin and ibuprofen should actually not be taken, and George is going to talk a little bit about that in the next slide. Finally, we also see that people with dengue should avoid mosquito-heavy areas to prevent the disease from spreading. That's more kind of a precaution from stopping the future spread of the disease rather than an actual treatment.
So, why would you not take aspirin or ibuprofen? Well, aspirin and ibuprofen are both blood thinners, and so because of this whole phenomenon in dengue where membranes of your blood vessels are more permeable, we don't exactly want to make the blood thinner because then it's easier to leak. And as aspirin and ibuprofen already have a tendency to increase bleeding and activate gastritis, because they are these blood thinners, we don't want people with dengue taking them, especially people with risk of dengue hemorrhagic fever, as that could exacerbate their symptoms. So, how exactly do we treat these types of diseases, like these subtypes of the disease, like dengue hemorrhagic fever and dengue shock syndrome? Well, it's kind of the same as regular dengue. So the only effective known treatment is fluid resuscitation, as with just normal dengue. But this fluid resuscitation really depends on the urinary output. So it's usually 0.5 to 1 milligram per milliliter per kilogram per hour. And this is in patients with stable vital signs and normal hematocrit. However, for patients with unstable vitals and decreasing hematocrit concentrations, likely due to dengue hemorrhagic fever, blood transfusions should be utilized, and packed red blood cells or whole blood is recommended, but platelets or frozen plasma are not recommended. But the efficacy of these treatments haven't been completely studied, as it isn't really ethical because it's in humans, and because treatment is really based off of what has worked in the past. And so these treatments are really based on kind of a case-by-case basis and kind of what the hospital who's giving the treatments has dealt with before.
Okay, so now we're going to talk a little bit about some vaccination options that we have for dengue fever.
So while there isn't a vaccination to prevent dengue fever, there is a vaccination to prevent secondary infections. This vaccine is called Denvaxia. It's a tetravalent, which is because there's 4 serotypes, live attenuated vaccine. And fun fact, on May 1st, so just a few weeks ago, 2019, the FDA voted to approve the use of Denvaxia in the US. And this is pretty controversial because Denvaxia is actually used, as I said, to prevent secondary infections. So it's used for people who have already contracted dengue. However, this wasn't known by the manufacturer, Sanofi Pasteur, until a little bit ago. So in the Philippines, actually, it was administered to, I think, thousands of children. And the Filipino government got super mad because they were like, hey, this vaccine increases the risk that these people will get dengue if they haven't had dengue before. And so they blocked it off of their market, and that's why it's pretty controversial that the US is accepting the use of Denvaxia in the US because stuff like this has happened. However, the FDA has put significant restrictions on Denvaxia, and I have warnings on the little packaging that say this is only for people who've had dengue before, and it's really like to prevent a secondary dengue infection. But Denvaxia has been approved in Mexico and Brazil since 2017, so I guess that strengthens the case of approving it in the US.
Yeah, I'd also like to note it's tetravalent, meaning for the 4 serotypes, but we've since actually discovered a 5th serotype of dengue fever, or the dengue virus. So that means that we actually don't have all 5 serotypes covered in the vaccine, which means that we either need to do more research, more work on trying to get the vaccine for that 5th serotype, or we just don't have complete vaccination for the disease. So now we're going to talk a little bit about antibiotic and antiviral, in this case, resistance. So since there are no vaccines, or vaccines really haven't been used much yet, and there aren't really any antiviral medications currently in use for dengue fever, dengue has actually yet to develop any sort of resistance to antiviral medications, or at least we don't have any reported cases of antiviral resistance in any sense in any nation.
But obviously this can change over time since Denvaxia is such a new vaccine, so hopefully dengue doesn't become resistant, but
right,
we don't know yet. Unfortunately, there is resistance within some of the treatments to prevent mosquitoes. Well, not specifically dengue, but mosquitoes are the ones that spread dengue, so in preventing mosquito bites, you kind of prevent dengue. So in recent years, the practice of protection of dengue and demosquitoing one's clothes with permethrin, or DEET, has partially failed in countries like Puerto Rico due to mosquitoes' resistance. To combat this, picardin, which is the natural version of permethrin, is used at similar concentrations. And so mosquitoes haven't showcased any resistance toward it, again, yet. We don't know if they'll show resistance in the future, but this is a largely successful treatment of combating permethrin resistance with picardin. So thank you for listening to our presentation.
Yeah, thank you. Woo!